Aloha and welcome back to Living 808. If you're in the other room, come be a part of this, because Derek Dickard, the director of the Castle Physician Network, along with Dr. Benjamin Roney?
Roney.
I want to make sure I get this right, because, Doctor, you're a family practice physician, and it's so important that you guys are here, because here at our work and many other workplaces around the country, we're all picking our new health plans, and we are very confused, and we are so glad you guys are here, because when we talk about a shortage of doctors in the state, you guys are on point with that, but when it comes to what Castle Medical Center is doing with new health plans, new doctors, talk about what you guys are doing with that shortage of doctors in the state. Is it something that we should be concerned about as a public?
Maybe not concerned, but at least aware of. Castle is aware of the shortage of doctors. On the windward side where we serve,
yes,
a lot of our doctors are approaching retirement age, and it's hard to recruit new physicians. Young physicians don't want to come in and do private practice.
And Derek, may I ask why? I mean, why do young physicians, I mean, what's the challenges, the reasons why you think they do?
A lot of it is financial. You know, it's $500,000 of student debt when you come out, maybe a little less depending on what your specialty is or where you went. And so doing that, plus the startup of just starting a practice, is very expensive. So doctors don't want to go that route anymore. And younger physicians just want to practice medicine. They don't want to do all the paperwork, all the running a business. They want to practice medicine and take care of their patients.
We hear that a lot. And Derek, I got to ask, you know, most people out there, we grow up, we're seeing doctors in that private practice, but what's the difference really when seeing, well, a private one or one in a hospital?
As far as to the patient, they're not going to see a huge difference. It's going to be just like they've always experienced, you know, when they've gone to private practice physician. Possibly their physician might have more time to spend with them, because they're having to do less time of paperwork and administration and things like that. And our records are linked with the hospital. So, you know, if you go see Dr. Roney or some of our other physicians and then you end up at the hospital for some reason, all those records are linked together, so the hospitalist will have the most up-to-date information.
Wow, that's amazing, especially in the technology field or medicine and technology. Now, Doctor, why did you decide to start your practice within the Castle Physician Network instead of, you know, going out on your own, sir?
I think Derek really hit one of the major issues, is that we don't go to business school. You know, the idea of coming out and starting a business to me was very intimidating. And so being able to walk in and take care of patients immediately, especially with a group, I mean, I agree and believe in their mission statement and what they're trying to do, serving the community, and it was what I trained in and what I wanted to do my whole life.
I love it. And I love seeing that, because I've heard from other doctors too, you know, sometimes with the paperwork, you just, your mind, your body, your time is taken away from your patients. And I got to ask for you, I mean, is it nice that you really get to focus on your patients and those things like that?
Absolutely, absolutely.
Wow.
To think of the amount of time that my staff helps me, and additionally, when I need to get a referral to someone within Castle Network, it makes it just so much quicker and easier.
Wow, and then that benefits the patients out there as well. Now, speaking of the patients, Doctor, though, when should someone set up an appointment with a primary care physician? And to be honest with you, okay, I for many years was still going to my child physician, and he's like, Tyzo, you're too old, come on. And to be honest with you, I haven't had time to find a primary care physician. So someone like me, what should I do? When should I call? What would be the best things to keep in mind, sir?
So, you know, people tend to go to the doctor when they're sick.
Yes.
But if you want to set up with a primary care doctor, it's probably the best to do it sooner rather than later, and when you're healthy. That way we can go through all of your health maintenance things. I mean, you don't want to worry about someone's broken leg when they need a colonoscopy. I mean, if we can do everything that needs to be done before there's a problem, it saves time and effort for everybody.
And Doctor, as a patient wanting to set a relationship up with a doctor, having that relationship going forward in the future, it helps, right? Because you know what he's like now. If you get sick in the future, you can sick and pick up those things quickly.
And that's the real benefit of a primary care doctor, is that you have someone who's taking care of you, or your parents or grandparents in some cases. They know your family history, they know your personal medical history.
I love it. Well, Derek, real quickly, if anybody out there wants to get more information, and again, this is good stuff, where should they go, sir?
If you want to get a hold of Dr. Roney's office, you can give us a call at 263-5017, or if you want to give us a call in our Kailua office, you can give us a call at 263-5015.
Awesome.
And we're there from 7 a.m. to 7 p.m. Monday through Friday, so if you do work like yourself and you can't get there, come after work and we'll be happy to see you.
See, those are important. They're always thinking about us and our busy schedule. But you guys, thank you so much. This is really important, and I think, Doctor, I'm going to be giving you a call if it's okay sometime soon. But this is great information you all should keep in mind, and Castle Medical Center always keeping us in mind as well.